Some therapists lose sessions to people because they had a great chat with a chat GPT about how they're feeling. And the thing that I came out with is private pay practices cannot compete with those companies, and they should not compete with these companies. They're in a completely different category.
This episode is brought to you by TherapyNotes, TherapyNotes.com. For the past 20 plus years, I've been working in the mental health field as a licensed therapist, private practice owner, coach, and consultant. And I've learned a lot the hard way, and I don't think you need to do the same. Hi there, I'm Gordon Brewer, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Whether you're just starting out, expanding your practice, or looking for fresh inspiration, this podcast is here to support you in your journey. Each week, we explore the real-world challenges and opportunities that come with building and growing your private practice. From marketing and money management to ethics, client care, and self-care, we cover it all. You'll hear from leading experts, seasoned clinicians, and innovative voices in the mental health and allied health fields, all sharing their insights and strategies to help you thrive in your practice. So let's jump in and get to today's episode of the Practice of Therapy podcast. Hello, friends, and welcome to the podcast. This is episode number 427 of the Practice of Therapy podcast, and I'm Gordon Brewer, and so glad you've joined me for this particular episode, and I hope you will take time to follow us or subscribe to the podcast in the places that you listen to it, and also follow us and subscribe on the Psychcraft network on YouTube. And you'll find links here in the show notes and the show summary. And you can get to that at youtube.com at Psychcraft Network. I'm looking forward to you hearing from my guest today. My good friend Avivit Fisher joined me again for this particular episode. And we have a great conversation about navigating the decisions around accepting insurance or being private pay, and some of the challenges of being a private pay therapist. But I think Avivit really breaks it down well as far as having us think about it in a different way and really becoming much more specialized in what we do. And also we talk a little bit about the effect of AI, which is it's a kind of a follow-up a little bit of last week's episode where I talk about the effect of tech companies coming into our space and AI and all of that sort of thing that I think is causing a lot of angst for a lot of people. But also, if you'll go back and listen to that episode, it was a solo episode of me just having some thoughts about that. One thing I'll say here is just a little side note. That episode, I apologize for the sound quality. I realized after I recorded it, I had used the wrong microphone. It used my camera microphone instead of my good podcasting microphone, but it's good content anyway, I think. But anyway, I digress. So we'll get to that conversation here in a minute. One of the things I'd like to invite you to do, though, is, actually two things I'd like to invite you to do. If you're interested in working with me and doing just some one-on-one consulting, I'd love to have a chat with you about that. You can go to our website, practiceoftherapy.com, and just click on that link up there at the top, the button on the top that says coaching and consulting. And we can set up a free 15-minute brainstorming session to see if consulting with me would be helpful. Check that out. And also, we are really focusing on the way in which we deliver content and maybe even changing a little bit up with the content we're delivering and focusing here this year on really building our YouTube channel over on the Psychcraft network. And if you'll go over to just youtube.com/@psychcraft network and subscribe to the channel there, I'm doing some little shorts on starting and building your private practice, along with some clinical things around men's mental health, because I get a lot of questions about that, just not necessarily from therapists, but the general public is kind of finding our channel and getting curious about it and asking questions just about men's mental health. And I guess it's because me being a male therapist, they feel like I'm the person to ask. So I don't know if that's has anything to do with it or not, but anyway, it's there. But anyway, I'd invite you to go over and subscribe to the channel. And also, real quickly, before we get to my conversation with Avivit, love for you to hear from our sponsors of the podcast, TherapyNotes.
Hi, this is Rachel, Gordon's podcast assistant, and I want to share the platform Gordon trusts for his own practice, TherapyNotes. TherapyNotes is the highest rated EHR, practice management, and billing software for mental health professionals. It's an all-in-one system for scheduling, notes, billing, and secure client communication. And if you ever need help, their 24/7 customer service is always just a call or email away. Their latest update, Therapy Fuel, uses AI to streamline documentation, generating progress notes, creating contact notes from client messages, and even summarizing client history forms, saving therapists hours every week. Are you ready to give it a try? Head to therapynotes.com, click Start My Free Trial, and use the code Gordon to get your first 2 months free. See why TherapyNotes is the most trusted EHR and the one Gordon chooses for his practice. Please enjoy the rest of the show.
Well, hello, everyone, and welcome again to the podcast. And I'm so thrilled to have back with me on the podcast my good friend Avivit Fisher. Welcome, Avivit. Glad you're here.
Thank you so much for having me. We were just talking about how it's been a long time, so I'm so happy to be here again.
Yes, and so for folks that might not know you, Avivit, tell folks a little more about yourself and how you got into this space of working with therapists around marketing.
Yeah, I mean, I've told this story quite a few times, but I love telling it. I'll repeat it. I started working with therapists in about 2017. And like everybody else who ends up in the mental health space, almost everybody that I meet, I ended up there because of personal reasons. In 2015, the apartment building where I lived with my family burned down. And subsequently, I was looking for help to process it and to cope with it, but I didn't really understand what I needed. So when I started looking for how to get over a house fire emotionally, I couldn't really find anything online. And then I saw the gap between, how therapists presented themselves then, it was 2015, 16, and what people were actually looking for. And I saw an opportunity to close this gap. And kind of help both the therapists attract more clients and also help people find the right therapist for them. So I've been working with therapists ever since. I've been helping them with marketing strategy, also with digital marketing and so on. And since then, my own business strategy has evolved more into business growth, helping therapists either transition from insurance to private pay, launching a private pay practice, and also scaling their private pay practice. And this is basically my sweet spot. I help them kind of differentiate themselves and stand out among other therapists, position themselves within the market with a very strong brand message, and put together a marketing system that they can own, that can attract the type of clients that they enjoy working with, that they're a good fit, and most importantly, those who can pay their fees. So that's a little bit about me.
Yeah. And I know before we started recording, part of what we started talking about, which I think is, this topic comes up a lot for people, and there's really two topics we want to try to maybe try to get to if we can, just about with the advent of AI and just things like BetterHelp and TalkSpace and all of that, and being a private pay clinician. But one of the things that I always tell people when I do consulting with them, and they're trying to make this decision between going kind of insurance based or going private pay, or even having a kind of a hybrid model, which I think is a good sweet spot for a lot of people, is you really have to make the decision about where you want to put your energy with all of this, because and you're the expert in this, in that for a private pay clinician, you're going to have to devote a lot of time and a lot of energy into marketing your practice in a way that helps you stand out and also reaches your ideal client, versus an insurance-based practice where you don't really have to do a lot of marketing, but the payoff, the downside is that there's a lot of work that has to go into credentialing and finding the right insurance companies to get on their panels with, and then be willing to have them dictate to you what you get paid. And so that's the downside. And then filing claims and following up. So I guess maybe the question is in your working with people that want to go private pay, what's the approach they really need to think about and the mindset they need to have around that?
So that's a very good question. And especially it becomes a little bit tricky when it's a hybrid model. So from operationally, right, from the point of view of insurance-based practice, those practices, they can go wide. They don't even necessarily need to have a very strong niche, because they accept insurance. So their whole approach is focusing on volume. So the more people you get to your practice, the more leads you get to your practice, the higher probability that your caseload is going to grow. With private pay, that's a little bit of a different mindset. And that's something that a lot of people don't really recognize right away. The mindset is you need to filter down the people. So the volume is not the approach. It's the targeted quality leads that you can generate. That's the approach, because the motivation for insurance clients is to find a provider within the insurance, right? So they need to find somebody who takes their insurance. And so that's the main motivator. The motivator for private pay clients, those are the ones who are looking for the best fit. So they're looking for the best therapist for them. So all your marketing and messaging needs to signal that you are the best therapist for a particular group of people, for a particular audience. And this is when niching comes into play and so on. Particularly when we have Headway, when we have Alma, those are the platforms that can really bring a lot of people to you. They can just send you leads. So the broader you are in terms of your expertise and experience, actually, I think that's that's better. So when you transition from insurance to private pay, you kind of need to shift that mindset of being all-inclusive to being very deliberate and filtering who you are trying to attract.
Yeah, I think it's, and that's, again, the thing that people have to weigh for themselves is, okay, do you want to attract clients that are only going to use their insurance, and you're going to have to go a higher volume with those number of clients,
right,
in order to probably meet the financial targets that you're looking for yourself, versus smaller number of clients that are also willing to pay you a higher premium for your services. And so, and it's, and I don't think there's any right answer, but you do have to approach it much differently and really I think I do a lot of kind of soul searching on the back end about what it is that you want your practice to look like, what you want your practice to be.
Yeah, you're completely correct. And when it comes to soul searching, you have to actually name the trade-offs, right? If you're going the insurance route, then the trade-off would be lower reimbursement fees, right? And in exchange for not having to invest in marketing so much, not having to actually invest in business growth as much and strategy. So you can focus more on your clinical work, right? When you go the private pay route, you have to actually, the trade-off is the volume, obviously, but the upside is the premium fees, being a little bit on your own terms, and you are more independent in terms of how you structure your future, how you structure your business future and financial future, and so on. So it really depends on. I think it depends a lot on personality of a therapist to make this decision.
Yeah, and I know a lot of I've talked with hundreds of therapists over the years on this podcast, and one of the things I think you have to really kind of start with is, what is the lifestyle you want to maintain for yourself? What is it that you need financially in order to make it worthwhile, in order to get the return on your investment of your time and your money, and really approach it from a business standpoint of what that could look like. There are people that their financial situation might be that they don't have to work full time or see that many clients. And so those are great people to really think about having a cash-based practice.
Before we had AT&T Business Wireless coverage, our delivery GPS wasn't the most reliable. Once our driver had to do a 14-point turn to get back on route. A 14-point turn! An influencer even live streamed the whole thing. Not good for business. Now with AT&T Business Wireless, routes are updating on the fly and deliveries are on time. And the influencer did get us 53 new followers though.
AT&T Business Wireless. Connecting changes everything.
When it comes to your pet, trust matters. At Second Street Animal Hospital, a new chapter is underway with new leadership and the same dependable care you count on. Their compassionate team treats every pet like their own, offering high-quality care for dogs, cats, and even exotic pets. From wellness visits to advanced medical and surgical services, Second Street combines modern medicine with genuine compassion. Visit secondstreetvet.com today. Second Street Animal Hospital. New leadership, trusted care.
I know one of my therapists, he's very, very much a person that caters to a certain type of client. Right. And that's why I connected with him, because he kind of works with, he works with other therapists, and he works with people that, have gone through different life transition things like I've experienced. And that's why I sought him out. And the thing about it is that he doesn't take insurance. And so that's okay with me because I can afford to pay that. And so I guess that's kind of getting to what you're looking at, or finding those kinds of clients.
Right. So I guess you connected to what he was saying, his messaging and the way he positioned themselves. Out of curiosity, how did you find him?
It's funny. I found him through word of mouth as much as anything.
Right.
Just that. And also, but as people know, I've got a lot of church connections. And so there were some church connections there. And I knew his background and kind of knew him personally. So that was how I found him, or how just knew about him ahead of time, really. So he didn't really have to market to me to find me, but I knew about him. I mean, he was known and trusted. And so that goes back to the marketing piece, is making sure that people know who you are, that you build credibility with people and trust, that whole know, like, and trust thing.
Yeah. And it's a good thing that you bring it up, word of mouth. When I work with my clients, one of the first strategies we go to is outreach and networking. And the interesting part about it is that the more specific you are in your message, when we define the message, when we say specifically, I work with these type of people, helping them in this way, and that's why and here are the reasons why I'm the best fit for them. when you reach out even to other therapists, to colleagues, it's much easier for them to remember you and refer to you. So as opposed to reaching out and saying, I have availability, can you send me any more clients? And like having sort of a generic note. It's no wonder why you heard about him word of mouth, because he built a reputation as a certain type of therapist. So that's a good thing to remember.
Yeah. And if we think about it, just thinking about the niche or however we want to say that, if I go to my doctor, my general practitioner, and there's a particular specific thing that I need help with, he's going to send me to a specialist in that area. And so I think being able to specialize really goes a long way in helping people market. And you're also as a therapist going to be much happier because you're working with your ideal client in that way.
Yeah, you are. And it's, there's many reasons to feel happier. There are ways you work with people that you really truly enjoy and find meaning and satisfaction in working with them professionally. You also, once you build your caseload and reputation, you also can be less burned out as a result, because your caseload doesn't have to be so full like an insurance therapist, and you can plan financially better, I think. So there's a lot of upside definitely to being a private pay.
Sure. One of the things, a question that gets asked, and we talked about this a little bit before we started recording, and I'm hearing this question a lot just to people that send me questions or, just respond on Instagram or whatever, how there's a lot of anxiety that people have in private practice about using platforms like BetterHelp, Talkspace. I would categorize them as tech companies that have gotten into the mental health space. Right. And a lot of people are saying, well, it's going to get me clients. Do I drink the Kool-Aid and do that? But also they think, well, I worry about competing with those platforms and that I'm not going to be able to get clients because those platforms are there, or they're stealing my clients, or however they want to phrase that. What have you learned about that? Or how do you kind of think about that?
So I have observed a lot what's been happening in the market for the past couple of years. And not only tech companies, but also AI changed a lot of things. So I know some therapists lose sessions to people because they had a great chat with a chat GPT about how they're feeling. And the thing that I came out with is private pay practices cannot compete with those companies, and they should not compete with these companies. They're in a completely different category. So those companies, the whole point of those companies is creating access to therapy for people at an affordable rate, right? So they're offering affordability and access, right? A private pay practice cannot compete on access and affordability. It's just they will lose. So they need to compete on quality and personalization, and I coin it being human on purpose kind of things. You have to think about it. I don't compete with them. I can't win because they have different budgets. They have, they have a monopoly in many ways. But the way I can position myself as a premium level of care and have a very strong message there, this will attract clients that will not go to Talkspace, that would not go and look for a therapist through Headway. They want somebody who they can connect with. They want somebody who makes them feel like they're getting the best of the best. And this is how you need to think about it. It's premium level of care. It's different. It's and that's the mindset that you have to adopt right now, in my opinion.
Right. Yeah. So, and I agree with you totally. Is that the other thing too, is that at least what I'm seeing in my practice, because we offer both telehealth and we also have in person, far and away, more and more people are wanting to come in person because they recognize being on a screen, you lose something. And I think, again, that's a very specific kind of client, as opposed to maybe a client that's busy and doesn't want to drive to the office, that kind of thing. And so that's a different category of client. And so, yeah.
I completely agree with you. And funny, I mean, it's not related. I have a friend who just opened a yoga studio, and she's seeing that people are really enjoying the connection, the human connection, the coming, the personal care. And obviously, yoga studio is a different experience, but I'm seeing that also when I observe my own behavior, I'd rather go to a doctor's office than seeing a doctor on screen. I had to see a doctor on screen. Yes, it's convenient, but I don't feel like I'm being checked properly.
Right.
Yeah.
Exactly. Yeah. And so I think that's a big selling point, so to speak, for having a cash pay practice. The other thing too, just as a side, is that cash pay practices, as far as operationally, are much easier to run than an insurance-based practice. And I just know that from my own experience, because my practice uses kind of a hybrid model. And that was a big decision I made, whether to accept insurance or not, or do a hybrid model. And I think you can do both profitably, but you have to have a different mindset about it.
Yeah, that's right. And I'll tell you more. I keep hearing, I don't know if you hear that, but I hear like, oh, people can't afford therapy right now. Why would the people pay for therapy out of pocket? There's this fear among therapists that people would not pay out of pocket. And to that, I just observed other industries, and I'm looking around and I'm seeing that, for example, there are more and more medical spas popping up. None of them take insurance. All of them are cash pay. That's only an indicator that people pay for what matters to them. People pay for things that they feel that they, can get value from, and they can significantly improve their lives. It's for somebody, it's skincare. For other people, it's mental health. But the challenge becomes for therapists is to communicate how to the audience that they're trying to attract, what value you can bring to somebody by working with them. And I think that once people recognize it and know it, they pay the fee.
Right. Yeah. So, Avivit, I know we have to be mindful of our time, but tell folks that are interested in working with you the ways to go about the different ways in which you help people.
Wonderful. The easiest way to find me is to go on my website, redstrategy.com, with red with 2 Ds. There is actually a lot of resources and information there. I recently created a whole library, a glossary of terms, marketing terms for private pay practices. So you can find everything there. I also wrote a brief that goes deep into the topic of private pay practice in 2026. So you can download it. That's completely free. And you can always schedule a call with me. It's strategic direction call. That's what I call it. We sit for 60 minutes and we'll really look under the hood of your private practice. So that's the easiest way to find me, to work with me, and to really look through all the resources that I created in the last 10 years of working with therapists. I have a lot of insight, and I really understand what therapists and private pay specifically need.
Yes. And Avivit has always been one of my go-to people for marketing in private practice. And so I can actually recommend her. So that's always a good thing. The other thing I'll say about Avivit is that she just has a great way of just really listening well and understanding what therapists are needing for their practice. So we'll have links here in the show notes and the show summaries for people to access all of that easier. So what's next on the horizon for you, Avivit?
I want to champion the private pay therapy practice model. I believe in it very strongly. I believe in being human on purpose. Even though I do work with AI and I also understand the AI tools, but I do think that therapists will become much more valuable in the future. And I want to be there for you. Yeah. Thank you so much for, again, having me over. It's always such a pleasure talking to you. I feel like we're just chatting. So
yes, that's how I try to do this. So, but and also I'll mention too, Avivit has a great email newsletter that comes out. And it's just packed full of great information. So when you get to her website, do sign up for that because it's great stuff. So, well, Avivit, go ahead.
Thank you. It's called Therapy Business Brief. Yeah. And it comes out every Friday in the afternoon.
All right. I'm sure we'll be talking again here soon. Thanks again, Avivit.
Thank you. Appreciate it.
So glad Avivit joined me again on the podcast. I really enjoy listening to her and hearing from her, and I hope you did too. You know, she's really kind of my go-to expert when it comes to private pay marketing in private practice. She has just devoted a lot of time and energy, and as I mentioned, do take time to go over to Red Strategy, and you'll find links here in the show notes and the show summary, and check out all of her resources. Her newsletter, as I mentioned, is one of the best out there as far as understanding the ins and outs of marketing within her space. So be sure and check her out. And I'm sure you'll get to hear from Avivit again here on the Practice of Therapy podcast. Also, big thanks to TherapyNotes for being a sponsor of this podcast. They are the leading electronic health record system for mental health providers. They're who I use in my practice and have for years now, and absolutely am just totally impressed in the ways in which they keep improving their platform and making it better and easier to use for therapists. And now with their AI capabilities, particularly around writing progress notes and session notes, it's really streamlined what we do as far as our clinical documentation. And their Therapy Fuel add-on is just absolutely almost flawless in my opinion. But anyway, be sure and check it out. If you'll go to practiceoftherapy.com/therapynotes and be sure and use that coupon code or promo code, just Gordon, Gordon, and you can try them out for 2 months for free. So be sure and check them out. And also check out our SiteCraft Network YouTube channel. And again, it's on YouTube. And if you'll just put in there at SiteCraft Network, it'll get you to the channel and subscribe to it. And we're going to be adding lots more content to that. And if you happen to be a podcaster or thinking about having a podcast, be sure and contact me. Doing some new things with the network, and that we're offering different membership levels to the network. And there's actually going to be a free entry-level membership. So you can check that out and stay tuned for that. I haven't quite got the landing pages and stuff up yet, but you can check it out anyway. So be sure to do that. And do take time to follow us and subscribe to the podcast wherever you might be listening to it. So take care, folks, and we'll be back again next week. You have been listening to the Practice of Therapy podcast with Gordon Brewer, part of the SiteCraft network of podcasts. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free Private Practice Startup Guide at practiceoftherapy.com. And to find more great podcasts like this one, please visit the SiteCraft Network at sitecraftnetwork.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. And if you need help in these areas, be sure to find the right professional to help you with these things.
With Verbal's last-minute deals, you can save over $50 on your spring getaway. So whether it's a mountain escape with friends, a family week at the beach, or sightseeing in a new city, there's still time to get great discounts. Book your next stay now. Average savings $72. Select homes only.